Welcome back to Hardball. Tonight we expect to hear President Obama talk about reforming the health care system, a long overdue agenda item for the Democrats. It's an issue important to Dr. Howard Dean, who's a medical doctor, former governor of Vermont, former chairman of the Democratic National Committee, but once a doctor, always a doctor, right? Just like a priest. So what do you think about this? I mean, the Democrats have been promising health care for this country since Harry Truman. 60-some years ago. And have failed relentlessly. Ted Kennedy, according to this new book about him, which is pretty favorable by the Boston Globe, said that he regrets that he didn't cut a deal with Nixon back in '71 when Nixon declared for a total national health care program, which included mandated benefits requiring employers to provide health care for all their employees. That was an opportunity. Okay, I'm just asking to set that up. You don't have to revisit that. All right. Is the answer here not to go left and move to the center, but to put together a real coalition with the pharma people, with people like the chamber people, who are business people, who do know they need health care funding to help reduce their costs, and go at it a new way. Try some new way to go after this thing.
Barack Obama's health care bill actually does that. It's a very, very good bill. And the reason it's a good bill is
he has a bill.
He has a bill. He talked about it during the campaign. I haven't actually seen a written bill, but I know he's got a plan, and he had it in the campaign. I've been doing this since '78 or something when I was a medical student chasing around Ted Kennedy and Jacob Javits. This is the best one I've seen. The reason is the change comes at the pace the American people are comfortable with it. The bottom line, to make it a very complicated subject, if simple, is if you have no insurance or you work for a small business, you get to choose, just like the Congress people do, from maybe 15 insurance companies. One of those insurance companies is essentially Medicare. It's a public entity. If Americans can do that, they will change the health care system at the pace they're comfortable changing it. And if that bill passes, he has succeeded in restructuring.
Won't everybody choose Medicare?
Not everybody will choose Medicare, but a lot of people will, which is why the health insurance industry...
People love Medicare.
People love Medicare. It works.
Yeah.
And a lot of people will choose it. It's the solution for the car companies, for example, to get the retiree health care costs. For 55, if you retire at 55, which many auto workers do, they have 10 years with no government benefits of any kind. The companies pick that up. It's one of the reasons they're in trouble financially. You could do a lot for small businesses and American business by enacting Barack Obama's plan for universal health care, and the American people will be completely comfortable with it because all we're doing is rearranging the options that people already have. We're not introducing any new options. There's nothing they have to understand that's different or complicated or Harry and Louise-like, as we saw 50
well, look, this country's got 40, 50 million people out there that don't have health insurance. They got to go to emergency rooms. If Barack Obama will he be able to fix that problem so they don't have to go to emergency rooms anymore? They'll have a doctor?
You'll have a doctor. Because if you're on Medicare, if you choose that option, you'll have a doctor. And you don't have to choose that option.
We haven't been able to do this in good times. We haven't been able to do this, Republican, Democrats. We've been dicking around about this thing for years, decades now. It's just not gotten solved. Why do you think we can solve it during the worst economic crisis we've had since the 30s?
Because it's the worst economic crisis we've had since the 30s. People finally get this. The business community has been really in trouble for years over this particular issue. And finally, they can't afford it anymore. Because we're in terrible economic times, a large number of middle-class people are either losing their health insurance or no. Small businesses get bailed out by this bill.
Give me hope. You got Mitt Romney up in Massachusetts. He wasn't much of a politician, but he did get through some health care plan. Schwarzenegger's had some problems in California. Another Republican has got a health care plan. Can you put together their modicum of success and progress with the fact that business people like the Chamber, Tom Donahue, people like that, I assume are for health care, and farm people like that, the insurance companies, the health the pharmaceutical companies. Can you put it together politically so it's actually going to happen for once?
You can't put it together without making some enemies. In this case, the enemies will be health insurance companies, because when you can choose Medicare, they don't like that. But the truth of the matter is you want to maximize the American people's choice. We're going to find out. Bipartisanship sometimes means putting together new coalitions. We would like the Republicans to support Barack Obama's bill. If Barack Obama's bill gets changed to exclude the public entity, it's not health insurance reform. And if it stays the way he talked about it in their campaign, it is major health insurance reform. And the goal of Harry Truman from 60 years ago, the goal of the business community, the goal of doctors, even the pharmaceutical companies will be on board for this bill that Barack's folks have put together. But it rises and falls on whether the public is allowed to choose Medicare if they're under 65 or not. If they're allowed to choose Medicare as an option, this bill will be real health care reform. If they're not, we'll be back fighting about it for another 20 years before somebody tries again.
Who's point person inside right now in the administration? Who's health care?
That's not clear to me. I don't know the answer to that. Although there's an awful lot of talk. That's the director of the OMB, who happens to know a great deal about health care.
Orsag.
Yeah, Peter Orsag.
Yeah, he's a smart guy.
Yeah.
Well, I wish you luck. I hope you become head of HHS, by the way. I think it'd be great.
Thanks
my opinion.
Thanks
I don't want to yours.
Job.
Thank you. Well, Mr. President, you're watching. This is your guy. Chairman of the party, brought you to victory. Give him a piece of it. Anyway, thank you, Howard Dean. Dr. Howard Dean, up next.